Chances are you're here because you've got questions about your heart disease and this therapy known as EECP, external counterpulsation, a non-invasive treatment for angina or heart failure. I'm here because, well, I've undergone EECP treatment myself. I'm Cliff Johnson, and I'm not an actor or anything, so forgive me if my presentation is a little rough. You can be sure of one thing. I'm going to tell it to you straight, and straight from the heart.
Well, I just couldn't live a normal life. I mean, when you're in pain all the time.
If I went to the mailbox, I'd have to go slowly.
It was just a struggle for me to even get showered.
I would get angina driving my car.
If I would bend over to tie my shoe, when I stood up, I had angina pain.
I pretty much was couch-bound or in bed most of the time.
You just can't do anything without getting chest pains.
Did you recognize yourself? I did. I've been there. I had a couple of bypasses and a stent, but the blockages and the pain just kept coming back. I was pretty convinced they'd never see my kids grow up.
It took a real toll on me, day after day after day, not seeing any light at the end of the tunnel.
I knew in my mind that you just progressively got worse.
I got to the point where I just said, I can't do this anymore. I can't live like this. We need to find something that can help me.
For 70 to 80% of the people who find themselves at this point, that something could be Vasomedical's EECP therapy.
There are lots of people out there having angina once a day, once every couple of days, taking nitroglycerin on good medical therapy, who might be able to be benefited from this procedure.
The patient who's going to benefit most from EECP is the patient that has already gone through conventional therapy and still has a diminished quality of life and continues to have symptoms.
We've treated people as young as in their 30s and as old as over 100. Basically, it's the patient who tells us that I have chest discomfort that's interfering with my ability to live life.
These people want to be more active. They are not willing to just be sedentary and continue to keep taking nitroglycerin after nitroglycerin.
It just wasn't the type of lifestyle I'd want to live.
It's not really living. It's existing.
These are people who are active, older people who want to continue to have an active life. And I think we can help them a great deal. 70
to 80% of our patients show a significant improvement after therapy, and that improvement continues to about 55–60% of them after 2 years.
Just like everything else in medicine, no therapeutic intervention is 100% successful. But we've found that the majority of our patients have had a significant reduction in their chest pain, and this has enabled them to exercise more freely, more vigorously, and to enjoy a broader spectrum of lifestyle activities.
I'm impressed that in a neighborhood of 75% of patients who go through this procedure, by the time they're up to 15 or 16 or 20 treatments, they're beginning to notice a difference.
EECP is pretty well tolerated. I have patients in their 80s and 90s that have been able to undergo EECP and have a very good response to treatment.
Nothing punctures the skin. There's no needles or catheters or anything like that.
It's a non-invasive procedure with lower initial risk.
My cardiologist, who I trust very much, said this is our best shot. We should do it, so I decided to go ahead and do it.
And there was nothing to lose by trying this.
I said, this is going to work. And I had that idea all through it. This is going to work.
Having a good attitude increases your odds of success with any treatment. So does taking your meds, making lifestyle changes, and in the case of Vasomedical's EECP therapy, making the commitment.
It requires 35 one-hour treatments. That's clearly important right up front.
They've gotten to know me pretty well at the doctor's office.
So what's going to happen an hour a day, 5 days a week for 7 weeks?
Well, first of all, they're going to have their legs squeezed, whatever their heart rate is, 80 times a minute. And it's a fairly vigorous squeeze.
There's pressure on the lower extremities, which does force blood flow back toward the heart, toward the central circulation, and jousts the body a little bit, but not to too great an extent. And in our experience, patients have had no problem tolerating it.
I fell asleep a few times. Or you can lay there and talk, or you could lay there and read.
They are carefully monitored, so the blood pressure is monitored, the pulse is monitored, the oxygenation is monitored. It's done in a setting where you have typically a nurse or a technician available to, stop it at any time. It's a very, very safe procedure.
How much easier can it get to get your life back?
The patient generally, after about 10 to 15 treatments, starts to feel a difference in terms of how frequently the angina is occurring, how severe it's occurring, how long it's lasting, and continues to improve over the course of the therapy.
That's what all the squeezing and releasing is about. It isn't at all random. Leads, like EKG leads, hooked to the machine help detect your heart rhythm. When the machine is switched on, the sensors, timed to your pulse, trigger the cuffs around your legs to inflate and deflate in sequence. The inflation of the cuffs squeezes blood from your legs, pumping it back to fill your heart. The cuffs become an external pump, assisting your heart. Enhanced External Counterpulsation Therapy, EECP.
It took about midway through the 7 weeks, and I started noticing a difference then. Just how I was feeling in general, the pain level, everything was slowly getting better.
Okay, but how does EECP therapy actually help? In medical terms, what's the mechanism of action?
EECP may in fact serve to alter the properties of the blood vessels themselves and make it easier for the heart to pump blood and for the blood to flow through the vessels to the body.
I'm really convinced the blood flow to the heart muscle is improved. The efficiency of the heart muscle is improved.
And what this does is it makes it easier for the blood to be pumped through the body and take some of the work off the heart, may expand the arteries of the heart so more blood can go to the heart.
So this relief of chest pain is presumably not just sweeping the pain under the rug, so to speak, the equivalent of giving an analgesic, but it represents a beneficial effect upon the heart and its blood flow.
Most of my patients who we're doing this on have angina and left ventricular dysfunction, so they don't have normal heart function. So it works in those patients, and I don't see any reason why it shouldn't work in people whose main symptom is heart failure.
I've treated a lot of patients with heart failure with EECP. They generally tolerate the treatment well. Not only do their anginal symptoms improve, but also their heart failure symptoms.
It seems the benefit from EECP treatment results from having all that blood quickly and vigorously return to your heart. Researchers think this forceful reperfusion produces the same effect as brisk exercise.
EECP may be like exercise training for people who can't exercise.
And that passive exercise, again, takes them to another level in which they can maintain an exercise program.
They'll start to be able to do more before getting chest discomfort.
In about 5, 6, 7 treatments, I noticed I wasn't as short of breath, I could do more, and it just got better.
They may even have their chest discomfort totally eliminated.
The effects after EECP varies. Some patients will have a very good durable response that will last 2, 3, 4 years or more.
In general, our experience is that majority of patients, overwhelming majority, don't need a second therapy.
If I need it again, without hesitation, I'll do it again.
About 15 to 20% of patients who've had a good response to EECP will undergo repeat treatment at about a year. And when they undergo repeat treatment, they also get a very good symptomatic response in terms of reduction in the severity of chest pain.
And with the same low incidence of side effects.
Vasomedical's EECP therapy gives you a head start on becoming active again. And the more active you are, the more active you can continue to be. EECP therapy sets in motion a spiral, an upward spiral towards better health.
The fact that you can exercise tends to help sustain the benefits. It also is true that it enables you to be more self-realized in terms of doing what you need to do in your life, whether it be caring for your family or carrying on a job.
The doctor's job is to make patients feel better. And I think we do in 75% of the patients we try this on.
It's almost been 4 years since I had it done, and I don't see any reason I would need it for another 5-10 years, hopefully.
And these are patients who are resistant to a lot of therapy beforehand.
Now, after my last session, I can do all the things that I didn't know if I was ever going to be able to do again.
I couldn't cut the grass. Now I cut the grass with no problem.
Last September, we made a 12-day trip to China. Now, I'm 83 years old. I think I'm more active than most of my peers.
All the little things that you take for granted, you just get them all back.
I still carry nitro in my pocket, but I think it's just a security blanket.
To me, it's just a best-kept secret in the world. When, it's such a wonderful thing and it's available.
I've told other people about it and encouraged them to check into it.
I have told doctors about it, and they have no idea what it's all about and how successful it is.
They gave away the free t-shirt, I'd wear it all the time.
I told you I'd give it to you straight. Vasomedical's EECP therapy changed my life. I sincerely hope it's the answer for you too.
Everything worked out so great. I still can't believe it happened.
Every day is a gift.
Talk to your physician or healthcare provider about Vasomedical's EECP therapy to see if it's right for you.
I'm Fred Thompson, and I'm inside business. Nowhere is the value of technology greater than in the medical arena, where every advance has the potential to better or save human lives. Let's peer into the future with some cutting-edge developments in medical technology.
53-year-old John Villano remembers a day not too long ago when he could go bowling or play softball on the weekends. Then it happened. In 1993, at the age of 36, John started experiencing chest pain at the bowling alley and collapsed. He was having a heart attack. Stents, angioplasty, medication, even open heart surgery. John had been through it all. Then John's cardiologist told him about EECP.
Well, I never heard of EECP before, but after 4 heart attacks, triple bypass surgery, and numerous stents, I figured I might as well give it a try. I really didn't want to be cracked open again.
Within weeks of receiving the treatment, John's angina was gone. Clinical trials indicate John's case is not atypical, at least not in terms of the results.
My angina was terrible. I could hardly breathe. Forget about exercise. I couldn't even walk up my driveway.
Angina is a symptom of coronary artery disease, which is caused by a lack of blood flow to a segment of the muscle of the heart. This is manifest by either chest pain or chest discomfort, shortness of breath, or fatigue upon stress or exertion. EECP increases the blood flow to the heart.
In 1995, the FDA granted New York medical device manufacturer Vasomedical clearance to market EECP in the U.S. 4 years later, Medicare extended coverage to include the therapy. Today, EECP therapy is offered at hundreds of physicians' offices, clinics, and leading medical centers, including the Mayo Clinic, Cleveland Clinic, Duke University, and many more.
EECP consists of 3 sets of cuffs wrapped around the lower limbs and the buttocks of the patient. It is triggered by ECG, which is the heartbeat. During the diastole, which is the relaxation phase of the heart, the sequential inflation of the cuffs results in an increase in blood flow to the heart and the coronary arteries. During systole, which is the contraction phase of the heart, the simultaneous deflation of the cuffs results in systolic unloading, thereby significantly reduce the workload of the heart. The clinical safety and efficacy of EECP therapy has been well documented in hundreds of peer-reviewed publications. Findings consistently show a success rate of 75 to 80%.
The hour-long treatments are conducted daily for a period of 7 weeks on an outpatient basis. The full regimen consists of 35 treatments over the course of 7 weeks.
EECP is safe, non-invasive, is effective in improving the quality of life of patients with congestive heart failure and angina, has been proven to last up to 5 years after therapy, and is covered by Medicare and most third-party payers.
EECP should no longer considered as a last treatment option. We researchers believe that in certain stable coronary artery disease patients, it should be used first along with medication prior to any other interventional procedures.
How are you doing?
EECP is also less expensive than other treatment options. The clinical studies show that EECP reduces the emergency room visits and hospitalizations, which in turn reduces the healthcare cost.
I had EECP back in 2004, and I'm still enjoying its benefits today.
I am grateful for the treatment. I wish I'd heard of it earlier. EECP was able to give me my life back.
Patients should be asking their physicians about the EECP therapy.
My name is David. I'm a diabetic, and I also have heart problems. I had no feelings in my feet. Dr. Brewer recommended that I do this treatment.
Hi, I'm Greg Brewer. I'm an interventional cardiologist. I've worked in Knoxville for 16 years. Enhanced external counterpulsation is a technology that's been around for almost 50 years. We strap these like blood pressure cuffs, and the legs are squeezed to the rhythm of the heartbeat. It helps unload the heart so that it can pump more easily, but also creates a back pressure so that the perfusion is increased. EECP is an FDA-approved, Medicare reimburses it. There are specific indications for EECP, and it's for patients that has symptoms at rest, that's class 4. Class 3 is symptoms with minimal exertion. What EECP does is enhances the effect of vasodilation to improve circulation to the heart. It can revitalize old pathways. It improves the circulation by dilating collaterals. This recruits them, makes them dilate to handle more blood. What's really cool about it is after a course of treatment, which is usually 35 treatments, 1 hour per treatment, the majority of patients enjoy benefits up to 3 years.
I've tried it. I've done 35 treatments, and it's been very, very good for me.
I totally wish I had done it earlier.
And now, like I say, I can walk without a buggy. I can walk without a walking stick. It has helped me on my diabetic stuff, on my sugars, and also helping me on my neuropathy.
So I've not had to go in the hospital since. To me, that is a big step.
The more treatments I took, the better I got. And now I do have feeling in my feet.
If you were thinking about doing it, don't think twice. Just do it.
An hour after it, man, you feel so good. It's just you could jump up and down and holler. I just wish I'd known about this earlier.
began the Vasomedical Enhanced External Counterpulsation program to provide options for our patients close to home in a convenient location where we could provide therapy for them that was going to enhance their quality of life. We've found Vasomedical to be a wonderful company to work with.
The patients appreciate the opportunity to do EECP when they have no other options. Surgery is not an option. They're maxed out on their meds, and they're thankful for the chance to get their life back.
Before, when I would do my walks or even on the treadmill, I was really limited on how aggressive I could be. I had to go real slow. I couldn't have any inclines of any kind. Now I don't feel I have any limitations at all. I can walk wherever I want, pretty much go as fast as I want. Quite a difference.
Before EECP, I was limited in terms of being able to exercise for any length of period of time. Any type of exertion would make me tired. I would just be generally overall a malaise feeling.
Sometimes patients are fearful when starting therapy, but come to realize it can be very relaxing, and many patients actually fall asleep during the therapy.
The bed by Vasomedical has been more comfortable. They've been able to relax a little bit more and get the most out of their therapy.
The first couple weeks you didn't notice too much, and after that, then it just kind of gradually started, oh, well, I feel more awake in the mornings, and then I was starting to do jobs a little bit easier, and that's when I started to notice a difference. Not everybody needs it, but it's been great for me.
Allowing our patients to have this kind of life-benefiting treatment close to home is wonderful because they don't have to travel. It makes them easier to receive treatment. And it's just a wonderful opportunity that I think we have to give to our patients.
Thank you, Vasomedical, for giving us the opportunity to provide our patients with so much care so close.
I feel the Viroqua area is very fortunate to have the Vasomedical EECP program.
Are you having trouble doing the simplest tasks because of your angina? Are you limited as to where you can go because of your angina? Are you tired of having to use your nitro just to get by doing the things you must? Is your life ruled by physical limitations and your cardiologist told you you must just live with it? Tired of that awful headache and just plain drained feeling your nitro gives you? Your stents didn't last. You swore you wouldn't have another bypass again. You can't stand the thought of possibly adding another pill to that cupful you already take. You haven't tried EECP, Enhanced External Counterpulsation. No knives, no needles, no surgery, no pain. We'll get you up and moving again, enjoying those activities you thought you would never do again. Once again living instead of just existing. Ask your doctor. With no risks, why would they say no?
Hi, my name is Joe Winterman. I'm an RN at Ohio Valley Heart Care in Evansville, Indiana. I have an actual testimonial from a patient that recently completed his 35 treatments of EECP.
I am an 81-year-old diabetic with angina and aching legs. I have just completed a course of 35 EECP treatments. At first I was a skeptic. I did not believe that this procedure could help me very much. Now I am a believer. Here are some of the changes that I have noticed. I no longer feel any discomfort or pain in my chest. My legs feel younger, they do not ache, and I am able to walk for an extended period of time, something I could not do before. The varicose veins below my knees do not appear as distended as before treatment. My feet have more feeling and there is no discomfort. I am breathing more easily. My blood pressure has lowered from 160/80 to 130/70. I have an overall sense of well-being and am eager to start an exercise program, something which just seemed overwhelming before treatment. I find it hard to believe that something which could make such positive changes in the way I feel is completely unknown to so many people. I have not met anyone outside the medical world who has heard of this procedure. Heart patients need to know about this option. Robert Williamson, Henderson, Kentucky.
And if you'd like more information about enhanced external counterpulsation, please go to www.basomedical.com or www.eecp.com. Thank you.